Good evening, everybody. How's everybody? Thumbs up. Everybody doing good? Yes. Okay. Awesome. All right. Welcome to Courtney. Welcome to our information session for the Alvernia University PA program. My name is Renee Langstaff. I'm the chair of Department of Medical Science and the Physician Associate Program Director. I am joined today by Kelly Burr, who is the Director of Graduate Education Admissions, who assists us tremendously in the admissions process. So she will be somebody who you most likely will speak to in your process, in your admissions process, and also by some of our current students, which, to be quite honest with you, I'm fully aware you would rather talk to them than me tonight. And so I'm really grateful for them to be here. So thank you for joining us. There's two different ways we can do this. I have a PowerPoint that lays out the admissions criteria, which is also published on our website. Or I can give you my overview that I give people who come see me who are interested in the program. So do you want formal or do you want sort of informal? And then we'll dive into talking to the students. Do you have a vote? You could put it in the chat. You could put it in the chat. Formal or informal? Okay. Great. So this is normally when students come and get have a tour of the facilities, and I offer them this option. They usually go with this option as well. So and I feel like it's a little bit more genuine because I just really talk to you about the program and what I think is important, and then open it up for questions. So our program is an emerging program, which means that we have applied for and have been granted provisional accreditation by ARC-PA, which is the accrediting body for all PA programs. We were awarded that in the spring, and we had our first class matriculate in the fall of this year. We have two paths for admission. We have the traditional post-baccalaureate path, and we have a bio-PA route, an undergrad route here at Alvernia, where students are admitted as biology majors, and they actually complete 3 years of their biology studies and then come into the PA program their fourth year, where they finish up their electives, which are the PA curriculum courses, and then in the end of 5 years, they graduate with their bio-PA degree. Those two pathways, those students come in at the same time for a max cohort of 30 students at any given time is what we applied for, and we're approved by ARC-PA. It's a 24-month program. The first 12 months of study is didactic phase, which is split up into 3 semesters, starting in August of every year. The curriculum itself in the didactic phase of the program is a modular curriculum, meaning that there's several different ways you can do it. A lot of PA programs will schedule a curriculum that specific courses in physical diagnosis, medicine, pharmacology, etc. And then you study, for example, cardiovascular medicine, and you study that topic in all those separate courses. We instead made a module, the cardiovascular module, where the students will learn physical diagnosis, medicine, diagnostic studies, etc., all within that module. And we did that intentionally because we felt as though it would assist the students earlier on in the curriculum to learn how to apply critical thinking and to better prepare for clinical phase of the program and ultimately direct patient care. Sprinkled in the 2 years of the program, we actually have 26 OSCEs, which are standardized patient experiences. Again, if you ask the students today how much they love that, they probably will say, no, we don't. But again, with intention, we designed it that way so that by the time you come into clinical phase of the program and then clinical practice, you're better prepared and you feel more comfortable approaching a patient, doing a history, physical exam, doing a clinical assessment and plan, and then ordering your diagnostics. The second 12 months of the program is the clinical phase of the program, in which time the students will participate in 8 clinical rotations. Each of those is 4 weeks in length. There's the core rotations in internal medicine, family medicine, pediatrics, behavioral medicine, surgery, reproductive health, emergency medicine, and then the students will do one elective in a subspecialty in medicine or surgery. In between those 4-week rotations, they come back to campus to spend a full week with faculty again, so that we can do additional instruction, training, clinical skills, and assessment during that time. So that is really the sort of the big, broad overview of the program. Many times people will ask me what makes the program different, or what makes it stand out. Why should we consider coming to Alvernia? And I think this is how I answer them. There are several things I think are highlights, right, of the program. The first is the faculty. I was afforded the ability to hire faculty, all with experience in previous programs, some with extensive experience in accreditation. And I think that what they bring to the table in regards to experience is extremely helpful, both in design of the program and as we move along here, continue to develop the program. And they are very dedicated to the students and the success of the students. The next thing I tell people is the facilities, because the university allowed us to speak into the design of the facilities. We are in a new building, the John R. Post Center in Reading, in downtown Reading. All the courses, the classes are administered there for PA. We have a large lecture hall that is shared between PA and other College of Health Sciences programs. We have 3 clinical skills labs also on the 3rd floor. We have 2 PA simulation rooms on the 3rd floor. One is for ICU and one is for an outpatient room. We have a large physical diagnosis room, which is probably one of my favorite rooms. And that's one large room, again, intentionally designed so that when students have lab, they're all together and faculty are together. So we have uniformity in the delivery of the curriculum. We also share on the 2nd floor with nursing. We have an OSCE center, as I alluded to. So in my other program, we had to actually ship our students out for things like clinical skills and OSCEs, but we can do that right here in our facilities. There's also a medical simulation lab, and an and an anatomage lab, which is virtual anatomy. We have 4 virtual anatomy tables where the students integrate anatomy into the curriculum as well. We also have up and coming, and it's not finalized yet, but in the plans, the university bought another building that sits catty corner from John R. Post Center, and it's being developed. We're working with Berks Community Health to have a community health center in there. It'll be a functioning full-time health center for the community, and we eventually will be able to have early patient care experiences there, and faculty will have the ability to work there as well, should they choose to do so. So those are all things that I think are strong points or things that set us apart. I think in full transparency, students many times, or applicants many times, will also ask us about the fact that it's a new program. And I will tell you, we still are working out some kinks in the program, meaning certain things that we thought would go a certain way, maybe we have to adjustment so that they actually go the way that we initially planned. There's always things that happen that are a little bit different than we pictured. And so so that's something we work really hard on, is to do continuous self-assessment of the program itself, the outcomes of the students, and really the way that the facilities are running, and the way that the program is being delivered. So provisional accreditation means that we have entered a process that for every program that's provisionally accredited, it's the same process. It's a 24 to 28 month process, where now we have to bring our first 2 classes in. We have to obtain data. We have to do a self-study and then submit additional documents to ARC-PA. Those will be reviewed after the first class graduates, and then it'll be determined at that time if we have full continuing accreditation, which is a 10-year cycle. So that's where we are. Our admissions criteria are all published on the website, and if there's specific questions about that, we can go over that as well. But that's all laid out when you go to our website, sort of step by step of what you have to do to apply to our program. So if there's questions about that, we certainly can field those tonight as well. And then, as I said before, I did ask for several students to join us tonight, because I recognize that as an incoming student, there are certain viewpoints that really I can't give you. The students have to give you, and I know they'll be honest with you when they answer your questions. So please feel free when we get to that point to ask whatever questions you want. And if the students have any difficulties answering those questions, then we can hop in as well. So, so that is the quick and dirty. That's what I call my quick and dirty when I give my intro to the program. So I'm going to stop talking and ask at this point if anybody has any questions about anything that I've brought up so far. And you could put it in the chat, or you could raise your hand, or you could just ask.
I can start. Hi, I'm Sophia Macrella. I'm an active applicant in the 2025 cycle. You did mention last year during the information session about potentially adding a supplemental cadaver lab to go along with the anatomosh tables, and I was curious if that was something you guys are still looking into.
Yes. So the most honest answer to that is yes, we really want to do that. And we have had conversations with outside universities who have the ability to assist us with that. The final plans for that and have not been finished. So it's something we still would like to do. But right now, that is not a definitive part of the curriculum.
Thank
And
you.
Sophia, yes, and Sophia, to further expand on that, just to be clear, it would not be, what we're looking to do is not a full cadaver lab. It is a supplemental pro-dissected, several sections, right, for each module where perhaps, for example, during musculoskeletal, the students are able to come in and maybe see a dissected leg, right, to look at the knee joint and things like that. So, so the anatomage would still be the primary way to deliver the main part of the curriculum. It would be supplemental experience.
Okay, awesome. Thank you so much.
You're welcome.
Hi, my name is Belle. Did I cut someone off?
No, it's just me.
Sorry. I was wondering how far away the clinical rotations typically are from Alvernia.
Yep, that's a really great question. And again, most honest answer, our goal is to have 80% of the clinical rotations within a 60-mile radius of John R. Post Center. However, because of the current state of there's so many learners in the country, there's so many PA programs in Pennsylvania, and there's a lot of learners even in our immediate area. We will have to have distant rotations. And so that's something that any student may have to participate in. One of the sites that I've been developing is in West Virginia, which of course is not right 60 miles radius, but it's a great hub of opportunities for the students. We have a large health system down there. It's Charleston Area Medical Center that has offered us really wonderful rotations, and a lot of them, they actually now fall under the umbrella of, I believe it's Vidalia Health. And so now there's actually more potential opportunities in that area for us to continue to develop. When I did my site development trip last fall, I visited one of the outpatient reproductive health centers, and they had a birthing suite right there in the outpatient center. So, so I'm excited about West Virginia. I think it's a really good experience for students to be in a rural setting, when able. We do have in this area, in the Reading area, we work with Reading Hospital, which is a part of Tower Health and some other subsidiaries of Tower Health. We work with Lehigh Valley Hospital. We have a great relationship with St. Luke's, and they've expressed an interest in continuing to develop that as well. And Penn State is an option for us here too. So we do continue to expand our opportunities there. Wonderful thing I'm appreciative of is the ability to establish a contract with AMO, which is an outside agency that assists us in developing rotation should we be struggling in any particular area, or if a student wants to develop a rotation closer to their home, they can assist with us assist us with that as well. So does that answer your question?
Yes, thank you.
Okay, who else? It can be anything.
I guess I'll just ask a question. My name's Rachel. I've also applied to Alvernia's PA program for this cycle. Do you guys do anything in particular to help students prepare for the pants throughout their time?
Yes. So in all honesty, the entire program really is prep for the pants, right? Because, and this is why I say that, when we developed the curriculum, and what you do is you start with the competencies for entry-level PA program. And then we looked at different organizations, so American Medical Association, et cetera. We looked at their competencies, and we developed really, that list of competencies. Then we kind of backtracked to looking at the PANTS blueprint, and all of those resources when we actually made the curriculum, and our goals for the program. Then we made the curriculum, using all those things, including the PANTS blueprint, when we created the learning objectives for the courses, if that makes sense. So all of the curriculum is geared toward preparing students to have the knowledge base, the medical knowledge base, to take the PANTS exam, and also skills and competencies to entry as an entry-level PA. Does that make sense?
Yes, thank you so much.
Sure. The other thing, Rachel, is that we have plans to have supplementary prep for the PANTS for all the students as well. Whether that be a formal course that's delivered for the students, but there will be also something at the end of the program to prepare them for that. Okay, and Reagan has her hand up.
Hi, yes. So my question, I am not sure if this was answered in the beginning. The first 5 minutes, I clicked on a Zoom link that was provided like 2 hours ago, and it was not this meeting. It was just a different one. So now I'm in this one, and I'm not sure if this was answered or not, but I saw on the website, so there's a specific video where you're talking about the program and the interests of the program and the mission and whatnot. And one of the things that was mentioned that there is a preference for local applicants. So I was wondering how specific that means with local, and also if you have had if your current cohort of students has any students from outside of Pennsylvania.
Yeah, those are great questions. So yes, the answer to the first question is when we say local, yes, that is specific. And we do list the specific counties in our admissions criteria of what we consider local, which are all the bordering counties to where we are now. It is an admissions special consideration. So when we look at all of the admissions, the applications in a holistic manner, and it's one of the things that we take into consideration. The reason why we consider it to be a special consideration is that our overall motto for the program, looking at our goals, et cetera, we believe in, we recognize that in our community here in Reading, there is a large need for providers. And we believe in the train and retain model. So if we believe if applicants come to us and they're fairly local, that they will hopefully train locally and then they will work locally. So that's a way for us to give back to the community. That being said, it's not considered anything negative if you don't have any of those special considerations. And yes, we do have students who are currently enrolled who are not from Pennsylvania. From as far as California. We have some students with us. So if that's helpful.
All right, great, thank you.
Can I just add, just to give you an example, I'm a current student. My name's Kyle. I'm actually from Florida. So I don't know if that helps you there, but yes, I thought the same thing too in applying, but am from Florida, so it is doable.
Okay,
For
great,
sure.
thank you.
It is definitely not going to preclude you from being a strong applicant if you're not from Pennsylvania or local, the local communities. when we look at applications, again, there's a whole rubric and there's a holistic way in which we look at applicants. But I can tell you, as far as things that make you a strong applicant, one of the top things is academic rigor. So when we look at your transcripts, we actually look at the STEM courses that you've taken, when you've taken them, and how many you've taken together, because that's reflective of your ability to handle the volume of the PA curriculum. Because it's not really pretty, right? For our current students, it's a lot. The volume, there's a large amount of information that is given to you, and it doesn't really stop. And that's really the design of PA education, right? You get about 75–80% of med school education in a much shorter period of time. And so you have to be able to keep moving and to process that information in sort of a rapid fashion, if that's helpful. Let's see. Simran, is it Simran? Did I pronounce it correctly?
Yes, you did. Hi, my name is Simran. I am also an applicant for the 2025 cycle. I also clicked on the other Zoom link, so I wasn't here for the first 5 minutes of this meeting. So I was looking into so I went on the website and I see like the breakdown of the facts. The curriculum, I see that you guys have designed it. It's a modular system-based system, whereas like you're not separating the classes like pharmacology, anatomy, physiology. You want to center it around certain systems of the body. So my question is, how is the current cohort like receiving that? Do they like it? Are they enjoying it? Or do they find it a little bit more challenging?
Yeah, so I'm going to let the students talk about that. In all fairness, I think that we designed it specifically for a reason, but I'm not doing it, right? And when I went to PA school, it wasn't that way. And so I think that no matter what PA program you're in, it's challenging because of the volume. But I will ask, please, this current students to talk about that a little bit.
I guess I'll go ahead and start with that. So with my experience, obviously this is my first time taking a pharmacology curriculum at all. I will say that I personally like how our pharmacology is integrated into each module, because as we're learning about the different disorders and diseases for that particular module, it does help connect the dots better. And then this way we're not studying a bunch of different drugs and everything to where we can't understand it enough to be able to apply it to the information that is being presented to us, if that makes sense.
That does make sense. I can kind of see it from your viewpoint, but that's good. That's what I wanted to hear. Thank you.
Any
And like
any
sorry.
any other students? No, I was gonna say, any other students want to have
Going
comments
off of
about-
like what Kyle said, like you kind of learn a little bit of everything as you go, and you're not like stuck in one anatomy class for like an entire semester or anything. You kind of learn a little bit as you go. And like right now we're in neurology, like we're learning about certain anatomy with like the brain and spinal cord, but we're not focused on like the entire body. Like everything else is kind of broken up into little pieces, which kind of helps keep you going also.
Yeah, I was gonna say, in addition to Kyle and Jackie, like it's more digestible, kind of breaking up in systems because they all build on each other eventually, right? So it just, I mean, comparing to what I've heard from other programs, because I've had friends in other programs, they are kind of envious of this curriculum just because it's more digestible. So like we do dermatology for a certain amount of weeks, like let's say like a month, and then you take an exam, and then you're kind of like done with that, but you still have to retain that information because then you'll see in the next one, like we did hematology, and like dermatology kind of plays into that too, but you already have that background. So it's kind of like a nice like build up each time, and it's more digestible because I mean, as digestible as it can be, but it's more like you're compartmentalizing it in your brain, like, okay, we're on neurology now, but it kind of just all comes together, which I really like. I don't obviously know how other programs do it, but I really like it.
Thank you. And I think just what something I experienced in my other program, because I teach primarily cardiovascular section. And when I would try to pull concepts or information across, for example, I would do a case study and I would pull from PD, from physical diagnosis, and pull from pharm and pull from clinical skills. And the students didn't like it because they were like, no, we're talking about medicine today. And so I think this, and again, I think when you compartmentalize that way, when you're studying, in one way, it may be a little bit easier for students, but when you have to transition and start to take care of patients, I think it may be a little bit harder to make the transition. And I mean, this is me, sort of going off of, this is all anecdotal, right? So I think that that's just my experience, is that I think by setting up the curriculum this way, it sort of sets it up for the students to put it together better and to see how things work together. That was the goal, by doing that. So,
Yeah, I guess the one thing that I've talked to Professor Langstaff about, like for our OSCEs, when we do it like a dermatology and like you break it up, we kind of want to put everything in like a box to fit that specialty. So like our last OSCE, I was just kind of not thinking clearly. Like if someone just came to like the ED and had like this like problem, like I was just thinking, well, it has to be hematology. Like it was like, so that kind of is a downside of it. But once you talk about it and like try to not like put everything in a perfect little box based on symptoms for like case studies, it's easier. But it is hard to get out of that, because even our case studies, which is another part of our program that I really like for each section we do a dermatology case, or we do 2 dermatology cases, 2 hematology, and that was just for this past semester. But you almost, like, we come up with differential diagnoses, but you almost want to be like, well, it has to be hematological, right? But they want you to start thinking like, well, what if this person just came in and had like fatigue? Like, what else could it be? So they kind of like force you to go out of that, because we're studying that way, that we want to put everything, together, but it's still good.
And real quickly, just to piggyback off Courtney with the case studies, I know it may sound a little scary just hearing that, how it feels forced, but at the end of the day, it does get you kind of thinking in a different mindset. And you notice as more and more you do these case studies in the different modules, it starts to make a lot more sense. And it, what was I going to say? I can't even remember now. It like almost like again, it builds in the case studies as well. So like it teaches you how to like get more comfortable as well with what you're doing and understand why you do it that way and why you need to think that way versus just like a black and white picture.
mm-hmm. Because medicine isn't black and white, right? We want it to be, but it's not. So, okay. If it's okay, there are 4 questions, 4 hands raised, and there's also a question in the chat. So is it okay if I move on to the next question for everybody? Okay. So is it Mina? Did I say it right?
Yep, Mina. Although I guess
Wonderful.
my question is also the one in the chat of the 24 student classes. Are they? I am unmuted, right? Yeah.
No, I can hear you. Yep, go ahead.
Of the 24 students, is that just for the the traditional program, or does that also include the 3+2 students?
Yeah, so our max cohort is 30. We can take 30 every year total. So that would be a combination of the bio-PA and the post-bac. This year, it's all post-bac because the bio-PA program started, when it started, the first cohort will actually come in next year. I believe there is 12. Is that correct, Kelly? I believe there's 12 currently bio-PA students that will come in next year. My hope is that it's always balanced, that it's about 50-50. We won't know, just like for post-bac students, we don't make a final determination about the bio-PA students until they have to finish their spring semester, because they have to have a minimum GPA and they have very specific criteria to be offered the assured admissions. And so we'll know better. at the end of spring. I don't know that all 12, will come in, but we'll know better at that time. So
Okay, so then 18 for traditional applicants.
right now, correct.
Okay.
Now we do run a rolling admissions, and we have put some offers out. So my recommendation always is to apply sooner than later, because we do review them as they come in. I just think it's better, if you can get your application in. So, okay.
Oh, I also read on your website that admission decisions are made 4 to 8 weeks after. Is that like on average or guaranteed or just?
Nope. And in full honesty, our goal is to be faster than 4 weeks, and we just aren't this year. And we're trying to catch up. It's a little bit longer than that. And the reason we just we're balancing out, right, our priorities with the current students and keeping our admission cycle going. And so I don't want to tell you it's going to be less than 4 weeks, because I just right now that's not where we are. Our goal, however, by coming into next year, we hope to actually keep tighter to 2 to 3 weeks turnaround. So if you've applied and haven't heard anything from us, I'm very sorry. We are working through. We have more applications this year than we did last year, and we are working through them. So thank you for being patient with us.
No, I appreciate it. I just thought this was a place to ask.
It is. No, it's a great question. It's a great question, and we understand that once you hit submit and you get your application in, then I mean, if you're like me, you sit by your computer and you stare at your inbox, right? And you're like, where are they? What's taking so long? Why don't I have an answer? And so I understand that, and I know the whole process of applying to PA school is stressful. So we're really doing our best to get caught up with that. So
thank you. I appreciate it.
Sure. Yeah. I think Reagan, you're next. If I'm going sort of across left to right on my screen, so.
Yeah, so my question was regarding when you mentioned that your emphasis on academic rigor when doing your holistic review of applications. So I am currently in a research-based master's degree, and I don't know if that would be considered a special consideration or not, but I was wondering, when looking at science GPA, would you consider the courses I've taken in my master's alongside my bachelor's degree?
Yes. So there's two questions in there, I believe. The first question is having a master's and a specific master's a special consideration? Not necessarily, because when we look at all of your academics, we're really looking at the courses, when you took them, et cetera, like I described it before. So it's not necessarily because you have a master's in XYZ that you're a stronger candidate, but it's more depending on the courses you took in that master's and how many science courses that you have, STEM courses for us to look at. It very well could make you a stronger applicant. We do look at, when we look at your science GPA, your overall GPA, all of those, we do factor in the post-bac as well. And so, which is, depending on the student, for a lot of students, that's helpful. Because it ends up raising their GPA, how they did in their master's. And there's a lot of students who start off in undergrad and they don't perform strongly and end up doing better as time goes on, or sometimes there's something that happens right in the middle. And when we see that, we look for an explanation. So if that is ever the case for you, if there's a particular semester where you were sick or had something going on at home that caused some additional stress and difficulties with academics, I really suggest, not just for our program, but I think it's a great idea to explain that somewhere for the admissions committee to look at, because we know that things happen. Is that helpful?
Yes, thank you.
Okay, great. All right. Is it Aisha?
It's Aisha.
That's close.
You're okay.
Thank you.
I also applied this cycle, and I was just wondering how the program prepares students to collaborate with other healthcare disciplines, specifically when entering the work field after graduation.
Oh, I love that question. So we love interprofessional activities at Alvernia. And so I really honestly can say, first of all, just so everybody understands, the ARC-PA has a standard, it's a requirement that all PA programs do have interprofessional experiences. However, what I'm really pleased about is that the way that they're done at Alvernia, so I think don't just check a box. I think actually Alvernia does a really good job. So we collaborate with nursing, OT, athletic training, different disciplines in different ways, and I think that that's helpful. And it's not just one and done. There's several things that are scheduled throughout the curriculum. Our students started in the first week? But the students had an experience like that. So I actually will let the students comment on that a bit if you don't mind.
Yeah, so with that, like she said, in our first week, I think it was like day 3, we were at our Plex Center, which is where we interact with the PT students, OT students. It's pretty much an outside facility where they'll get you'll have a patient. I believe it's a pro bono type facility. So the patients can come in and get treatment with the PT students alongside with the OT students. So it was kind of interesting, as nerve-wracking as it is on your 3rd day and you're just getting thrown in and you're like, oh my God, I don't even know what I'm doing yet. It is very interesting to hear about the different healthcare specialties that are there too, like especially when working alongside the PT and OT students, because you kind of get to see what they're doing with the patient, how they're interacting, what their role is, and how that kind of like it all becomes like this, like as like the Lion King, like the circle of life almost type of thing. And you kind of see how like you all can work together to help that one patient. So I mean, like even in our 3rd day, we weren't treating because he had the patient had already been diagnosed with something, so they were more there for mobility and strength training. But given the opportunity that we were allowed to get a history on them, ask about medications, kind of figure out why they were there, and then we would collaborate with the PT and OT students and come up and like hear their plan to how that would help benefit their patient as they go along through the program. And then I don't know if anybody else wants to chime in on that as well.
Well, we've done a
Yeah.
couple of different like interprofessional stuff. Like we did the live patient one very early on, and then we did another one like 2 weeks ago, right before Thanksgiving, where we just kind of had like a paper case study, and we got to work with nursing, OT, PT, AT, and we kind of explained what we would do as a PA with the patients, and AT would say, kind of their view, things that they look for in patients, and kind of what their treatment plan would be, and kind of how they all relate together to get the patient the best care. So we've done a couple of them.
We did also get to hear from a speech pathologist and a social worker. So it goes, the scope of like the interprofessional experiences that you got are more than just your like the basic nurses, OT, PTs that you would normally assume.
Yeah, the other thing I just wanted to comment on is we also love to have other professionals come assist with things like clinical skills. So we have had nurses come and assist us with showing the students IV insertion. We had paramedics there. One of the nurses, actually, she's not a nurse, she's a tech, but somebody from the nursing department came to help us with that. So I'm a big fan of that. I think it's important for the students to not only learn how to work with other professions, but just to develop that respect for what they do as well. So, and I do also have to say that the students did such a good job during the IPE experiences that other faculty from other departments raved about them. So if we didn't tell you that, our students, they were very impressed after their 3rd day that they did what they did. And when they went back, they showed a marked improvement. And so I personally believe people will rise to the level that you set for them. And so we know that they didn't know how to do a full history and physical exam, but we knew they could talk to patients. And so that's what they did. Okay. So Daniel has his hand up, and then there's a question in the chat. So I'll let Daniel ask his question first.
Yeah, this question sort of came up earlier when the students were talking about some of the curriculum. Are there any anatomy or pharmacology resources that you guys know of to look over before, potentially school starts, just to keep up on that?
So so there are some basic text that are really good text, right? So Grant's Anatomy, Gray's Anatomy, Grant's Atlas, etc., are good. But you know what? I have to tell you though, Daniel, that several students emailed us before the start of the program, and they said, "What can we study? What should we be doing?" And really, our answer was, "We think you should be preparing to come into the PA program by resting." And spending time with your family and getting prepared, to enter really quite a rigorous time. And so what I would say, I would temper that with, it's always great to review things, but I wouldn't get yourself all worked up and kill yourself over studying right before you came into the program. If you think about it, if you were given an offer, you've shown that you have the basics, you have the background, right, to come into the program. So, so there is that. I'm a fan of coloring books. I think that I'm a kinetic learner, so those are helpful. Smart Anatomy is an app that you can use as well, that some of our students have used. You asked me, so it was anatomy. Was there another one?
It was about pharmacology.
Yeah. I feel a little bit differently about that. And the reason for that is, again, pharmacology is really tough because it's a little bit harder for me personally to connect the meds, to remember them, unless I'm also learning about the actual medicine and what they're treating. Does that make sense? So it may be helpful for you to review some pharm, but it may not be as helpful to do that because of that reason. And again, I don't know if the students have any thoughts on that, but I think to just study pharmacology without the additional information on the pharmacokinetics and the medicine, I think that's tough, because I think it's a lot of just rote memorization, and I think it would be frustrating. So I don't know.
That's good advice. Thank you.
Yeah,
No,
do the students have any different thoughts on that?
no, I actually just want to say I do agree with you on the pharm. I think if I studied pharmacology beforehand, I be reading a million times and rereading, not understanding a single thing. Because it is hard, because at least like thankfully when we started, we did get like a refresher, which was actually very nice to kind of, because again, like from my experience, I was out of undergrad for 2 years working prior to going into PA school. So like having to go back and remember basic anatomy was tough, but with the refreshers, it does help. I know there is an app that I use personally. It's called Complete Anatomy. It's very similar to our Anatomage.
Okay, I downloaded that one for free. Did you purchase it?
I did eventually, because there are extended resources that I like on there. There's some videos. There are functional anatomy videos too. So, I mean, we haven't gotten to some of the things yet, but at least when I get to the musculoskeletal system, I can sit there and watch how an arm's moving and how that muscle is working with that specific body part, which I think will be very beneficial at that time. And there are other things, like it'll let you do like quizzes and flashcards and whatnot on there while looking at like the anatomy of a body, which I think is very beneficial as well.
Yeah, I agree with everything Kyle and Professor Lingstaff has said. Like, yes, there are resources. There's a million anatomy things. At the end of the day, anatomy is anatomy. You can buy as many flashcards off of Amazon as you want and learn as much about the body as you can. The pharmacology app, there's Hippocrates. That's a great app. But again, if you're just reading medicines over and over again, it's not really going to mean anything to you. And I wouldn't stress too much about trying to study before you get into school. Like if you've graduated from undergrad in some sort of major that has something to do with like healthcare and biology and stuff, they're going to give you everything that we need to know for our exams to be a good PA. Like they're going to give you all of that information. So there's no point in like stressing yourself out beforehand. Whatever patient care experience you have or that you're currently doing or you did in the past is going to teach you a lot of stuff that you won't learn in a textbook. So just kind of trusting that if you get accepted, it's for the right reasons. You don't have to stress about trying to prep too much before coming in.
Yeah.
Thank you.
Sure. So if it's okay, I know Kirti has her hand raised, and I would like to answer a question, two questions in here. The first question in the chat is, what community service opportunities have this year's cohort participated in so far? So we elected our student society members for SAPA, the American Academy of PAs, just fairly recently. And by design, because we wanted the students to acclimate, to the program and to the curriculum. So they haven't done a lot of that yet, but they've already started planning. And so I don't want them to do too many right away. I want them to work into that because academics come first, right? But community service is one of our top goals. The program, and it's really important to us and the university. It's in alignment with our university mission as well and vision. So there's lots of really great things that we can continue to do as a program and even students individually. So that will happen for sure. There just hasn't been a whole lot yet because they just started in August. And it's listen, again, I think no matter what PA program you go into, and even if the design is different, it all feels like drinking out of a water hose, right? It all is a lot all at once, and you are going to have to adjust your study, the way you study and consume the information. And so a lot of students resist that. They don't want to change the way that they approach the information, and rightfully so, because things have worked in undergrad. But just keep that in mind as well, that you will have to have some adjustment no matter what program you go into. So give yourself grace with that because that's not unusual at all for students to have to do that. So, and then the other question is, with the rise of telehealth after COVID, does the program have a curriculum module dedicated to telehealth, for example, diagnosing and treating over telehealth? Glad you asked. So again, we function currently, we applied for provisional accreditation under the 5th edition standards, ARC-PA 5th edition standards, the 6th edition standards. The initial, copy was sent out. It's not finalized yet, but it's required now that telehealth be a part of your curriculum. And it's something we intended on working into the curriculum anyway. Our medical director actually used to be the director of telehealth at Tower Health. And so the answer is yes. Not at the current moment, the students haven't done anything yet, but yes, that's going to be worked into it. Okay. And then is it Kirti?
Okay, it's Kirti.
Kirti?
But I
Nice
just
to
have
meet you, Kirti.
a quick question. Yes. So do you just only offer in-state rotations, or do you offer any out-of-state or even international rotations?
Yes. So I'm not sure, you might have joined us a little bit like we did talk about this a little bit. We do offer
Yeah,
out-of-state
I was in that other
rotations.
link. Sorry.
Sorry, I don't know what happened with our link. I apologize. We we would like to have the majority of our students do the majority of their rotations within 60 miles. And so a lot of that would be in state in Pennsylvania.
Okay.
However, we have developed a hub in West Virginia and in other states as well. And so most likely, most students will do something out of state. That's just a reality. Now, the other thing is there are some students who would like to do a rotation close to their home or in their hometown, and we are working with students to attempt to set that up as well. The rate limiting factors for that is all administrative. There's legal paperwork. We need an affiliation agreement, and we have to follow our own vetting process to ensure it's an appropriate site for the student. As long as that all lines up, then yes, that's an option as well. We do not currently have international rotations as an option. I don't know, to be honest with you, if that will be an option later. To me, the priority was making sure that we had what we needed stateside for the students. And so that's where we're focusing now.
Okay, thank you.
You're welcome. All right, so there's a question in here. It's a great question because we're getting close to time here and I want to be respectful of the students' time and all of you. The question is, to the current students, what is your favorite part about this program and why did you choose this program? So I'll have all of you answer that. And yes, please be honest. Go ahead, Kyle, you can go first.
I was gonna say Kyle normally goes first for everything.
Sorry, thank you. Okay, so originally when I was looking into programs and came across Alvernia University, their program, I really liked the way they were academically doing everything curriculum-wise. And I really liked the uniqueness compared to other programs, especially having, as I was a student during COVID and undergrad and having to go through the online systems and having to deal with that, and like you weren't in person for like, I think I was online for probably a year, so and forth. But anyways, I really liked how they had they scheduled it out to be an asynchronous curriculum, which would allow me to also have like a normal life throughout PA school. And when I say normal, it's just meaning like enough time to kind of do the things that I would like to do, whether that's a hobby or anything. I feel having that, I can't even, my words are just not happening today. Sorry, but having that, wow. Anyways, what I'm trying to say is having that option really meant a lot to me. And I just think it allows you to kind of take control of your own academics. And I really aspired for that. And I will say one of the things that I thoroughly enjoy about this program, minus the way the curriculum is structured, is I have a lot of appreciation for the staff. I think they are great individuals. So just like throughout my experience so far, it's amazing to see how with a short amount or with a small class, how the faculty really does show their care for the students and your success. And I just think that's very heartwarming. And the friends that you make immediately in this program is insane. Like you don't even expect how it's going to happen, but it just kind of happens. And that's something that you can't just pull out of thin air. It's just kind of there, which is amazing. So that's my reasonings behind it.
I'll go. I have 4 reasons I kind of came up with that I'll just go through pretty quickly. First one, just strictly being location. I'm from Maryland. It's about 2 hours from here. That was just something that I didn't really want to move too far away from home. Not that you can really be super picky with PA schools because it is super competitive. So getting an acceptance to a place that was pretty close to home was really nice for me. Second thing was the staff and how easy they were to get in contact with. When I got my acceptance, I was going on a 3-week trip to Europe in like 3 days and needed to make my decision super quickly and with no interview or anything. I had so many questions about it before making like that big decision. And I was able to get in contact with a bunch of professors and Kelly Burr and everybody multiple times a day, as much as I needed to in order to make that decision. And I feel like now being in the program, nothing's really changed. They're still super easy to get in contact with, to meet up with, always willing to help and everything. Okay, that was two, which means I had two more. Oh, and then another one was kind of what we talked about, the modules, how it was set up. I thought that that really stood out from other programs, and I really liked that. And then also how we're not sitting in class from like 8 a.m. to 5 p.m. Like if you're in any Facebook group chats or on TikTok or you have friends in PA school, it seems really intimidating that they sit in class from 8 a.m. to 5 or 6 p.m. and then they go home and they study for 5 more hours. We get a lot of asynchronous stuff. We got some live Zooms where we're not just sitting in a classroom for multiple hours a day. So if you want to go on a run or go out to dinner, go to lunch with your friends, you can schedule time to do that, which is really nice. Those are my four.
Thank you. Courtney, do you mind going?
Sorry, I'll go really quick. So I live in the area around Reading, so I kind of knew Alvernia. I had some friends that went there, so I always knew it was like a good small school. I went to Penn State, which was super, super big. So this was a nice change. I didn't meet the staff before. Kelly Burr helped me with a lot of my questions because, like Jackie said, there wasn't like an interview or anything. So I was just kind of like, this seems too good to be true. So but once I got and met the staff, I was like, oh my gosh, I can't like imagine not doing this program and meeting all the people in my cohort. And most importantly, like all the professors are so nice and like super personable. I had a couple other interviews with other schools and I didn't get that vibe from any of the professors. So they like immediately, felt really welcoming, and you just kind of have like a feeling that, for me, I didn't get to meet them before or have like a meeting like this. But after I did, I was like, oh my gosh, this is like the most perfect program for me as well, with like Jackie and Kyle's reasons, like the flexibility, how you can talk to them. They want us to do well and as much as we want to do well. So like it really does show every day. And I think that's different because a lot of it could be intimidating. And I was skeptical at first, being like, I'm not sure if they're going to have their first cohort and stuff like that. But thinking about it in a way where, like the other big schools, you're just kind of like, they've been doing the same thing every year for a while. So it's kind of like you're expected. Like this program, they really like foster you into, making you like the best student you can be without like so much pressure, if that makes any sense.
So I can go really quick. So one of my favorite parts, I think, is the people that I've met. So because our class is so small, you build such close relationships with everybody, especially we've only been here a couple months, and I feel like I've known a lot of these people now for such a long time. Because it's also so small, you get to work really closely with your advisors and your professors. They all know you really well. You have a good relationship with all of them, and they are your support system for the 2 years that you are here. So I also agree with what everyone else said. The hybrid based really allows you to kind of build time for yourself and prioritize yourself in some ways. And I also live pretty close. I didn't want to go far far from home.
Thank you to all the students. I just wanted to touch on two additional things. So the hybrid model that they're referring to, again, was by design. What we found in our previous programs was that students, I wouldn't do well, right? Sitting, like you said, all the time in person in class from 8 to 5. But we thought it would help with quality of life and balance. For example, I will get up early. I would prefer to get up really early and work, and Professor Henderson will be up until like all hours of the night, right? Like I can't do that. I actually, she probably does both. but do you know what I'm saying? That's like some people just work better sometimes, like after they get their run in, or they have a doctor's appointment, that they made a year ago. They they need to be able to do that. So we wanted to give the students some flexibility. And that was based off of data that we collected at one of my other programs, my other program, where that was the feedback from students then. And we also collected that information from students who are currently enrolled. And as you hear them say, they really do want some mix of hybrid. So meaning there are some lectures that are in person where you're sitting in person in the lecture hall and the lecture is right there in person. There are some live Zooms where it's live, the lecture is on Zoom with you and they go through things with you. And then there's recorded. And so if it's recorded, then, you know, and we schedule time for you. So we make sure if there's a recorded session, we put it on the schedule. So we'll say from 3 to 5, this is a recorded session. And it's up to the students if they want to watch it from 3 to 5, or if they want to watch it from 6 to 9, or if they want to watch it the next day, as long as they stay on track, then that's what the most important thing is. And so that's just to expand a little bit on that. And I also just wanted to touch upon the interviews. We specifically did not have interviews in the admissions process for several reasons. The first is that we looked at data in our other program, and there was no clear correlation with interview indicating, giving us the ability to identify if a student was going to have professionalism issues, or did it really help us in determining which students we made offers to, and we really decided it did not. Therefore, when we were looking at this program, we did not want to create barriers for admissions, and I think it's very expensive for students, for example, who are from Florida, right, or California, to come in for a day for an interview. And so we thought that because it was not necessarily helpful, and because it could potentially be a barrier for admissions, we did not want to do that. So this is why we have these informational sessions in part, so that applicants have the opportunity to meet some faculty and students and to ask their questions. We feel that that is a more effective or efficient way to do that for applicants. So that was the rationale behind that. So, and then Madison, did you have a question? Madison didn't.
Yes, ma'am. Thank you.
Okay.
I'm sorry. I cannot figure out how to put the little hand on.
That's okay. That's all right. Go ahead.
So my name is Madison Besner. I'm from Texas, so pretty far away also. And I'm currently on the wait list for Alvernia, and I was just wondering if you had any thoughts or recommendations on what would be the best way to like keep improving my self while I'm waiting, and if I need to be submitting any like current like work experience or things like that.
Yeah, chime in too, but my thought on that is anything that is a part of your application that continues to grow. If you take additional classes, if you're doing more direct patient care experiences, community service, leadership, anything like that, if you have an update, I would do that. Excuse me. I would definitely update. And then I don't have your application in front of me, and so I don't know. I wouldn't be able to tell you specifically, you know, things to do, but you know, again, all of those things we look at, and we do pull from our wait list. So that just so you know, it's early in our admissions process, and so a wait list is not a no. When we just make the decision to put somebody on the wait list, we fully understand that we can pull any of those people, and we have in the past. So I don't know, Kelly, if you have any additional thoughts on that.
Yeah, so if you have any additional information that you're doing, hours of observation and so forth, you could always send that. I do receive a high volume of emails. So if you can put it in kind of a resume document that I can attach to your file, that would probably be best as opposed to getting a string of emails. Anything like just save up your hours or any additional things that you're doing that would be of relevance that you would want the review committee to know. And feel free to forward that to me.
Okay, via email, or if I upload it on Caspa, will y'all get a notification, or would you like me to?
You can send it to me and I'll make sure it gets uploaded to your file. Yep.
Okay, thank you. I appreciate it.
Sure.
It wouldn't hurt. You can always send an email to the physician associate email as well, which is monitored by the faculty, just to notify us that you've updated as well. You know, so that may be helpful too. If it's, so I think, Mina, did you have another question? Was there any other questions?
Oh, I guess I do have a question. So if it's very early in your application cycle, can you say like if you've already given out a certain amount of seats, or is that still like something that can't really be shared? I was just wondering if that's.
Yeah, that's a fair question. It's difficult for me to comment sometimes because it's so dynamic, because we put out offers and then people have to give us an answer, right? So what I can tell you is that I don't know the exact number, but several people have already accepted an offer, and that there are other offers out. So offers go out every few weeks or so. But there are seats still available for sure. We are not only interviewing for waitlist at this time, if that's helpful.
Okay,
We
great.
definitely are still filling the class.
Mhm.
If it's okay, out of respect for the students that joined us tonight, I would like to let them go because they have work to do, I'm sure, and I wanted to thank them again. I'm willing to stay on for a few more minutes if there's any additional questions, but I just wanted to make sure that Courtney and Jackie, Kyle, and Bella can go do what they have to do. So thank you again for joining us. I think it was really helpful.
Yeah. Thank you for your time and sharing your experiences.
Of course,
Nice
it's nice
meeting you
meeting
guys.
everyone. Good luck.
Nice
through the
meeting you all.
process.
Good luck. This program's awesome. I love Professor Langstaff and everybody you'll meet. So I just wanted to say that.
Thank you. That's so nice. They don't always love me, honestly. I'm just saying it's, that's okay though. All right. So let's see if there's another question here. Okay. Okay, good. So thank you for thanking us. Let me just ask and then I'll wrap up. Is there any follow-up questions or any other questions that you have that were not answered this evening? Claire?
Sorry, I couldn't figure out how to unmute. I'm Claire. I just was curious. I did see in one of the videos attached on the website that statistics was required as a prerequisite, and that it was a preference to be a science-based or math-based statistics. I was a psychology major, so I took psychological statistics as that was part of my major. And that I also did research methods, which was attached to that as like a lab requirement. And then in addition to that, I took pre-calculus, which showed just that I was able to take a higher up math course. And I was wondering if that was considered that I took that higher up math course and not necessarily the regular statistics, if that mattered, or if there's anything else I can do to fulfill that prerequisite, I guess.
Yeah, so two answers I have for you. The first is that no, that taking the pre-calc doesn't have anything to do with the actual stats requirement. The best way for us to answer you is for us to actually look at the syllabus, I think, to be fair. So if you want to send an email to the physician associate email and ask specifically about your stats, then we can pull it up and we can pull up the syllabus. And then I think that's the most fair way to answer you. Does that work, Claire?
Yes, that works absolutely.
Okay.
Thank you.
Just to be fair, to give you the most complete answer, I would be more comfortable looking at that. Now, that being said, the reason, just so you understand, the reason why we say that about the stats is that a math-based or science-based stats will prepare you better for the evidence-based practice that you'll do in the program. But again, let's look at what was covered in that course. Okay.
Yep, great. Thank you.
You're welcome. All right. Any other questions? Okay, so I can't believe it's 7:15. So thank you everybody for joining us. I really appreciate your time. I know how valuable your time is. Thank you for your interest in our program. If you have any additional questions, Ms. Burr is available. We're available, the physician associate email. Please feel free to reach out. And if you watch our website, we will post additional information. So if we have another informational session like this, you won't probably gain that much out of that, but we do have an optional accepted students day, and we also have open houses and things like that at the university. And so that may be helpful for you as well if you're able to attend any of those things. And so keep an eye on that. And again, just let us know if you have any questions. Okay.
Thank you for your time.
All right. Thank you
Good
for
night.
joining us, everybody. All right.
Bye.
Have a good night.